Good morning, everyone. Today's session is going to be really helpful and it is led by Dr. Promila Singh from Apollo Cradle and Children's Hospital. She's going to talk about role of vitamin D in pregnancy. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Okay, good afternoon, everybody. So, as I'm being told, and I'm going to update you about vitamin D and its role in pregnancy. So, everybody is hearing a statement these days: I am vitamin D deficient. Vitamin D deficient. What is the role? How much is the exactly? How much do we define exactly? What is vitamin D deficiency? What are the clinical parameters? What are the risks associated with vitamin D deficiency, especially in pregnancy? So, first of all, coming on to what is vitamin D deficiency? What are the critical limits when we say that I or you are vitamin D deficient? So, the critical limits are less than 30 nanomoles per liter. So, if you are less than 30 nanomoles per liter, then you are vitamin D deficient. Now, second stage is vitamin D insufficiency, which is like it is not, it is between 30 to 50 nanograms per liter. So if you are above 50, then you have optimum vitamin D concentration in the body. So how do we manage all these things? Is vitamin D screening is required during pregnancy? There are no guidelines as present which talk about uh, there should be a screening done before pregnancy or during pregnancy. It is just like to maintain the vitamin D levels in pregnancy is beneficial for the unborn baby. So, how do we maintain this vitamin D level? See, vitamin D level maintenance should be around optimally should be between 30 to 50. In the normal Indian population these days, vitamin D levels, if checked, are below 12. So, why these vitamin D levels are going down? Because of inadequate sun exposure, or somebody is suffering from any disease like celiac disease, or somebody is on any drug like phenytoin, or somebody is institutionalized, like somebody is kept in surrounding where there is no exposure to sunlight. So, after preventing and analyzing all these things, we should get our vitamin D checked. Coming on to the pregnant females and the role in vitamin D, it has been seen in several studies that if a pregnant lady has vitamin D less than 30, there are certain risks during pregnancy. What are these risks? These risks are like she is like uh, her baby, the unborn baby, can have deficiency in vitamin D and calcium after he or she is born. So she can develop osteomalacia during pregnancies, and there are incidences of raised incidences of preeclampsia, gestational hypertension, and gestational diabetes mellitus if there is significant decreased concentration of vitamin D in pregnancy. So how can we prevent this? What are the guidelines to prevent this vitamin D uh, deficiency in pregnancy or insufficiency in pregnancy? Generally, what we recommend is like optimal dose of vitamin D should be given in all the adults. Like what is the optimal dose now? The question rises: the optimal dose is like around 800 to 1000 international unit in the sufficient and individuals who have already sufficient level of vitamin D in their blood. So if the vitamin D is level is less than 30, the optimal dose is like around 50,000 per week, what we are giving. So like 60, in pregnancies, higher doses, they have not been studied. So there are guidelines like we should give, it is better to give low doses like 1000 to 2000 international units per day rather than giving higher doses like weekly 60,000 or getting iron injections in pregnancies. So, like all the supplements which gynecologists are giving, calcium is around 1000 milligrams, like 1250, with 2000 international unit of vitamin D. So this is the perfect dose. So if you're pregnant, you should check like what is the dose given by a gynecologist during pregnancy. What is the level of the calcium in that dose? How many milligrams of calcium is there? How many international units of vitamin D is there? Because if vitamin D doses are insufficient, and that might affect your baby. The baby can come of decreased weight and reduced birth size. It has been studied like it was a study that 192 females were arranged in a study, and it was seen that the females who had decreased level of vitamin D and supplementation was not given. The baby size was comparatively less in the length and the weight also compared to the pregnant females who were given adequate vitamin D supplementation and had adequate levels of vitamin D. So this deciphers that the role of vitamin D is very important in the growth size and the birth weight of the baby. And it was also studied that after few years of postnatal life, the chances of osteomalacia and rickets in such kids who were born to vitamin D deficient mothers was very, very high. So it is important to, take proper vitamin D in your diet. Proper adequate sun exposure should be there, and calcium supplementation is there. Because what does vitamin D do actually? Vitamin D helps in calcium absorption from the intestines. This is the role of vitamin D. It helps to absorb calcium from the intestine. So if vitamin D is less, how does the calcium get absorbed? Calcium gets absorbed by the marked increased secretion of parathyroid hormone. Parathyroid hormone increases, and it helps to absorb calcium by channelizing vitamin D and conversion of vitamin D. So optimal vitamin D presence in body is also seen by the levels of parathyroid hormone. It should not be increased. There should be marked optimal suppression of parathyroid hormone when we are going for evaluation of vitamin D actual deficiency. It is not only the levels of the vitamin D which is important, it is also the levels of marked suppression of the parathyroid hormone which is also important. So, like, how do we monitor vitamin D? So our target is to achieve around more than 30. So how do we monitor if the patient is deficient in vitamin D? Should be monitored after giving supplementation weekly of about 50,000 or daily. We need to evaluate vitamin D levels again after at least 3 to 4 months. So we see the optimal titers are gained or not. In the case optimal titers are not gained, we repeat the course. In case the optimal titers are gained, then we give the daily basis of vitamin D. That is around 600 to 800 international units, in which the targets have been achieved. In the range, if the range is between 30 to 50, then we give around 1000 international unit daily. This is how we monitor vitamin D levels. So in pregnancy, we do not get them done again and again. Like there are no screening guidelines. Prenatal vitamins are given. Calcium is given routinely. So we expect the vitamin D levels to be at the sufficient range. So we do not monitor them again and again. We just supplement the females uh, for the uh, adequate maintenance of the levels. So, like, what else? Do you have any questions to ask uh, in the forum? Do you have any questions to ask about the approach or vitamin D replacements, something like that? Anybody in the forum, any questions? Because I think I've spoken enough. So we have to remember only three things, as we do not screen the female patients for vitamin D routinely. We have to at least target them to achieve a normal sufficient level by supplementing vitamin D with 800 to 1000 international unit at least daily with the calcium tablets. And in case the female is suffering from celiac disease or she has any chronic kidney disease, we should also look for urinary excretion of calcium and concretions of the calcium. In case the patient has celiac disease or any kind of malabsorption, we should look out and rule out, and then we can also screen and offer them monitoring of the vitamin D and calcium. And I think I'm done. छोटा सा topic. This is a very small topic. Any questions? Vitamin D has also an important role in lactation and reduce incidence of fracture during life.
Doctor, there are no questions for now.
Can
No
we
questions.
can we stop the
Yes, yes, you can
discussion?
end.
Okay, thank you so much.
Thank you.
Disconnect, na?